The doctor will be with you in a little bit, Scarlett.
Hey, is it cool for me to go home? I'm exhausted and my boyfriend's cooking supper.
Yeah, you can get out of here. Have a good night.
Thank you. I'm so excited just to sit down and have a nice meal. I cannot wait.
So how's your night, babe?
Long. Started off with morning sickness and then we got slammed at the dinner rush.
That sounds stressful. Hey, I got something for you. I'll be right back.
Has that needle been used?
No. Well, just once. Me and my buddy Billy. You know Billy. He's cool.
You know how hard we work to quit.
Ain't that strong, babe? Just a little bit'll help you relax.
No, not again. I'm not gonna take anything that's gonna hurt the baby.
Ain't gonna harm him one bit.
We still don't know it's a him.
Yeah, it's definitely a boy. You'll see.
Hey, Andy. Hey, yeah, we'll figure out why your temperature spiked to 101. And you said your throat was sore as well? Okay, well, the doctor will be with you soon, Andy.
What's this?
Welcome to your first night in the gay community.
Thanks, Ricky.
You know, that old timer's been staring you down since we got here.
Where? Who are you talking about?
Him.
The one in the tie?
I mean, he's not too bad on the ice.
Hey guys, what's up, handsome?
Not much.
I've been checking you out from across the bar.
We know.
Would you like to dance?
I don't know.
Oh, come on, please.
Well, see, I'm here with my friend here, and I mean, I do like dancing.
Great, let's go.
Have fun, Auntie. You deserve to be happy.
I'm pretty new to all this.
It's okay. I'll show you what to do. Come over here.
The doctor will be with you soon, Maria.
But today, there'll be a lot of noise as the Saints sellout crowd greets the new look Cowboys. Jimmy Johnson makes
You sure you don't want to go out for my sister's birthday?
Yep, I'm sure.
Look, you know I love your sister. Just love football a little more. Look, the game just started. Just tell her I'll pin some dollars on her later for her birthday. Okay?
Will do.
Alright, look, just be safe and have a good time, alright?
Okay, we shouldn't be out too late.
Alright.
Love you.
Love you.
Hey! 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 Hey, Maria! What's wrong?
I don't know. My head's really dizzy and my stomach's hurting really bad.
You're fine. You're overreacting.
No, okay? I think someone slipped in my drink. I don't feel good.
You've been working at that hospital way too long and watching too many crime shows.
Hey, what's going on? You ladies okay?
I don't know. Maria thinks she was drugged or something. Can you please take her home or the hospital or wherever? I'm missing my party.
Of course. I'll take you wherever you need to go, Maria.
You remember Paul, right? He works with Dad?
Yeah, I think so. I don't...
Okay, you're fine. I'll call you tomorrow. Thanks, Paul. I owe you one.
I hate to think you were drugged. That's terrible.
No. I'm never coming back, Brian. That was so stupid. No, I'm not gonna let you see her when she's born. No, I'm not coming back. I'm drug-free now, and I pray my baby is safe. I gotta go.
Scarlett, we need some help.
Dad, do you care if I take the car to a friend's house?
No, it's been acting up again. Gotta take it to a shop today.
You need to eat, Andy.
I'm not that hungry.
You're not acting right. Something's going on. You're losing weight too. What's wrong?
Nothing. I just don't feel good.
Hey, plan on coming to the garage today. The boss said Hank didn't show up. We could use a set of extra hands.
I have a doc. No, I can't. I have to be at my friend's house for a school project.
What's her name?
Her name? Her name is Melissa.
Melissa. That's a pretty name, isn't it, Larry?
Yeah. What's that on your Saints cover? A sticker?
Yeah, a rainbow sticker.
A rainbow sticker? Isn't that what the...
What class are you and Melissa taking?
Biology.
I don't know why you have to be at a friend's house when we have...
School's important, Larry. He needs to get good grades. Just leave him alone.
Okay, fine.
I can drop you off on my way to work, Andy.
No, it's okay, Mom.
I don't mind.
No, it's okay. I'm going in the opposite direction. I'll just catch the bus or something.
Okay, but eat, Andy. I mean it.
Hi, this is Andy Lewis. I had an appointment with Dr. Derek for 10:30. I'm gonna have to reschedule again. I just missed the bus.
can't risk you infecting me.
We can use condoms.
The condoms break, and I want a family.
I do too. Okay? Look, we can work through this. Just, I'm sure there's something safe out there. I can talk to my doctor tomorrow about it. Just don't do this.
I'll be at my sister's.
George,
Goodbye.
please don't leave.
I have some great news for you, Scarlett.
Oh, yeah?
Yeah, your viral load is undetectable, which means that the likelihood of viral transmission to your baby is exceedingly low. So that's great news. What have you been doing differently? Aha, you're remembering to take your medications while you're at work.
Yeah, this was a great idea. If the alarm goes off and I'm with the table, I just ask them to excuse me for a minute. The customers seem to understand.
That's great. I'm so happy you're finding that the medications aren't a hindrance in your life. Look at that. Do you have your medications here?
I do.
Do you have any water?
Got one in my bag.
Super.
Thank you. Can I ask you for some advice?
Yes.
So I met a guy at NA. We've been talking for a while and now we want to take it to the next level. He knows I'm HIV positive, but we want to erase any sort of negative assumptions out there.
Okay, I see. Let me ask you a question. What's his HIV status?
He was tested recently. He is negative.
So do you remember how we talked about that if your viral load is undetectable, that there's an exceedingly low chance for viral transmission onto your baby?
I remember. And the medication is safe for the baby, right?
Correct. With your medications and undetectable viral load, you and your partner are going to be fine having sex. Plus, there's also a medication called PrEP, and we can talk about that later.
So you're saying that with my being positive and my undetectable viral load, I could have sex with my negative partner and we'd be okay?
That's exactly what I'm saying. Hey, Andy, you're early.
That's a surprise, huh?
How you been? You seem much more at ease since the last time we've seen one another.
I am. I've been going to the support groups you recommended. I didn't miss the bus. One of my friends that I met at the group is waiting out front for me. He offered to bring me here.
That's great. That really is. Listen, I'm actually looking at your labs right now, and they look great. How are things at home? How are your parents? I know that you were worried about them finding out about your sexuality and HIV status, and to be honest, I actually think that that was causing some of that depression, anxiety, and weight loss that you had been experiencing, which, by the way, looks like you've picked up a little bit of weight. You look great.
Yeah, I still haven't told him yet. I'm working on it. I'm 80% sure my mom knows. My dad is a different story. But the medicine the therapist is giving me is definitely helping with my depression and anxiety. Several of the group members were in the same boat as me, and they're offering me words of encouragement and advice. I don't feel so alone anymore.
You're never alone, Andy. And you said that you met with the case manager?
Yeah. She got me connected to a therapist, and we just started talking about what happened that night. It's still really hard to talk about.
Please keep seeing her, Maria.
I am.
You deserve to be happy.
I'm not going to give up, Dr. Drury.
How about George? Have you been in touch with him?
Not really. I meet with his mom and his sister a few times a week for coffee. They're super supportive of the diagnosis. It's just really nice to still be connected to the family.
Well, hopefully they can get George to come around.
I hope so. I miss him.
Viral load undetectable, huh?
That means you're doing great, Andy.
I feel great. The HIV medication and the medication for my depression and anxiety really helps me feel comfortable in my own skin. I even told my parents about my positive status and my sexuality.
Wow, really? How'd that go?
Well, my mom cried and hugged me and said she'd always knew I was gay. She's at the library now looking at books about HIV. My dad was upset at first, and then he was just like, put on some work clothes and come help me at the shop. But my best friend Ricky here needs your expert advice, Dr. Derry. He had a scare recently, and we were wondering if you could talk with him about it.
Sure. What's going on, Ricky?
I'm so embarrassed.
No, you don't have to be embarrassed here.
Okay, well, I met this guy a while ago, and we hooked up. During sex, the condom broke, and I'm not sure if he was positive or negative.
When was the last time you were tested for HIV?
It was about a year ago at the club they were testing, and I was negative.
Well, let's get you tested here now at the clinic, and let's kind of get that out of your mind.
Okay.
And either way, it's going to be fine. Look at Andy here, who's a great example. By the way, are you familiar with PrEP?
PrEP? What's that?
PrEP stands for pre-exposure prophylaxis, and these are medications that we use to help prevent the transmission of HIV.
Cool.
Studies show that the regular use of these medications for people who are HIV negative, it will significantly decrease the likelihood of HIV transmission. It actually will protect people who are HIV negative from getting HIV.
Okay.
Let's go ahead and get you started by getting tested right now. We have these 4th generation tests that allows for earlier detection of HIV, especially since you had a potential recent exposure.
All right. I'm ready.
Great.
Thanks for everything, Dr. Derry.
Anytime.
This is a lot to take in.
It is. It is a lot to take in. And I'm here with you, and our whole clinic staff is here with you as well. Okay? We strongly encourage you to also talk to family or friends about all this. All right, but the good news is that this is a disease that's very treatable. If I had an option between cancer, diabetes, or HIV, I'd rather have HIV because it's very predictable. I also know that with HIV, you're going to live the length of life as well as the quality of life of somebody who doesn't have HIV, just because you'll be taking those medications on a regular basis, and you come see me on a regular basis and you listen to me and take your medications on a regular basis, you'll do great. Our goal here is to get your viral load to undetectable levels so that you can continue being healthy. Okay?
All right.
Now, we can actually start treatment today if you want. Studies have shown that by starting therapy on the day of diagnosis, or as close to diagnosis as possible, that the outcomes for you in the future in terms of your health will be improved significantly, and also we can get that viral load to undetectable levels faster. Is that something that you'd want to do?
Yeah.
Get started right now, right? I have medications I can give you.
Sounds good.
Okay. Good job, Ricky. We're all going to be here with you together, okay?
I shouldn't have stormed out when you first told me. I shouldn't have treated you like that. And I'm so sorry. And I do still want to have a baby with you.
I know. We meet with the doctors this afternoon. We'll figure it out then.
Okay.
George, as long as Maria's viral load remains undetectable, and it is, you don't have to worry about contracting HIV. But if you are, we can talk about a thing called PrEP.
And what about conception?
Sure.
Wait,
without a condom, like the old-fashioned way.
Yeah, we'll make sure that we put Maria on medications that are going to be safe for the baby at the time of conception, as well at the time of delivery. That'll significantly decrease the likelihood of viral transmission to the baby.
All right, thank you, Doctor. Wow. Okay.